Hi there, this is Nicole Lee, Health, Beauty, and More. I have an important video here to go over with you on TMJ, and you might have noticed pain with your jaw opening and closing, maybe clicking when you open your mouth or yawn. It could be on one side or it could be on both sides, but it usually has to do with something that's causing the tightness and pain following that. Sometimes we grind our teeth at night, and that can produce problems like TMJ, temporal mandibular joint disorder. And the pain is not always that bad. In other cases, it can go into the ear and actually feel like an earache. And I've had that experience. And actually, if you have it on one side, that might mean that eventually you'll get it on the other side, but maybe not if you're lucky. It's good to always mention these things to your oral surgeon or dentist, and make sure that he diagnoses this, if it's TMJ or not, and see what they suggest for that. They might suggest some exercises. They might suggest alternating hot and cold packs. They might also suggest a over-the-counter medication. Also, a bite guard sometimes helps because people can sleep with their teeth and jaw clenched, which can produce more pain. And it can be to the point where you're getting a lot of headaches and neck pain. And we have muscles that run up and down here called the platysma, and that's a huge muscle on both sides that often is involved. In some cases, even the temporal muscles up in the top are involved as well. So when you have an acute case and it's really bothering you and you need to do something now, be careful about chewing on anything really hard. Experiences will tell you, like if you have what's too chewy for your mouth, you may experience problems with pain or discomfort in your jaw area, and that should tell you that it's just too much for you and you need to start eating softer foods for a while and maybe avoid those things that cause it. Things to avoid are usually very chewy candy, maybe even chips. And if you find that you are eating something that's a little bit too crunchy or hard to chew, just bite little tiny pieces. Don't overdo it and open and close your mouth too much. The side to side grinding usually is an indication of TMJ. And for me right now, it happens to be the side to side problem is more on this side. But when I go to palpate, which is like taking your fingers like this and circular motions, you can do it together on both sides and massage these areas. This will actually identify areas that are the most painful. And believe it or not, it's on this side, but I've always had for many years a lot of clicking on this side, and I thought nothing of it because it didn't seem to interfere with my meals or anything, or yawning or opening the mouth or grinding side to side. But that's an indication that could be related to that. It could be you've had dental work and possible malocclusion so that the mouth is not opening and closing evenly. One indication is when someone smiles, it may be up on one side a little more than the other, maybe a little crooked, and that's an indication of malocclusion or possibly temporal mandibular joint disorders. So try some of these massage exercises to start off with, and ice and heat. And I would say start with ice, maybe a minute or two of ice, then a minute or two of a warm pack, and then finish up with an ice pack because that'll calm down all the tension and irritation that's going on in cases where you really need immediate discomfort relief. So those are some things to start off with, and I know that it hurts to stretch, but the stretching can be done just by pushing your jaw, but don't go too far, and holding it and relax. You can do the same thing on the other side, pushing your jaw. That helps stretch it out. So I like to follow those kind of things with strengthening exercises because I really believe in that. One way to do that is just to keep your fist right here and try to open your mouth. Don't have to push too hard, and do it and try to hold it for about 10 seconds. And repeat that like 10 times and do it whenever you're sitting in front of the television, maybe three times a day to start off. And try to do about 10 repetitions when you're doing it. It helps strengthen the muscles in the joint as well. So there's so many more exercises that are helpful, but I just wanted to start you off with a few simple ones so that you can be on your way to feeling better. And I'm not a doctor, that's my disclaimer, but I do know some things and I do research a lot, and I hope these help you. Take care of yourself. Goodbye for now.